Hello everyone and welcome back to another NCLEX Review YouTube video. My name's Tiffany, a team member with NCLEX Review, and today we're going to be walking through some commonly seen acronyms in nursing practice. I know sometimes it can get confusing, but we'll walk through a few that you're most likely to see in practice and ones you will not want to miss. Let's start with the basics. So what is an acronym? If you're thinking of an abbreviation from the initial letters of each word in a phrase and pronounced as a word, then you would be right. Most of us use acronyms in our day-to-day life with communication. Maybe you're responding to a text message with LOL, laugh out loud, or OMG, oh my gosh. We use acronyms in our daily lives, but they can also be used in healthcare. A few things to keep in mind with acronyms. Errors can occur when using acronyms inappropriately. The Joint Commission has a list of do not use acronyms to prevent these errors from occurring. For example, we used to use IU, which stands for International Unit. However, IU can be mistaken for IV and is now not allowed to be used in practice and now requires International Unit to be written out. Now we're going to go through a nurse's note with some commonly used acronyms. A 45YO client presented to ED at 1300 with concerns of ABD pain. His vital signs, ECG, and lab work was completed stat upon arrival. BP was 148/90, HR 110, RR 16, and SpO2 98% on RA. Temp was 98 degrees Fahrenheit. The client's pain began in the AM. Client rates pain 5 out of 10. A CBC CMP troponin was drawn. The client has a HX of lung CA. The client takes ASA 81 mg PO QD due to HX of CVA. Client denies SOA or chest pain. Client will be going down to CT shortly. Now go ahead and pause this video if you need to take some time to read this over again and write down what you think some of these may mean. But let's start by going through a few questions related to this client. We know that the client presented to the ED, which is an emergency department, with ABD pain. What does ABD stand for? What do you think? Great job! Now, if you guessed abdominal pain, that would be correct. So this is a commonly seen abbreviation when documenting pain, surgical site, or wound site, and even while completing assessments. All right, so now let's put this scenario on again and see if you can determine what some of these abbreviations are. Now go ahead and pause this video. You can use a scratch piece of paper and write down what you think some of these acronyms may mean. We will review them when you're ready. All right, now let's walk through what some of these acronyms are. So we have a 45-year-old client who presented to the emergency department at 1300 with concerns of abdominal pain. His vital signs, electrocardiogram, and lab work was completed immediately upon arrival. His blood pressure was 148/90, heart rate was 110, respiratory rate was 16, saturation of peripheral oxygen was 98% on room air, temperature was 98 degrees Fahrenheit, and the client's pain began in the morning. Client rates pain 5 out of 10, a complete blood count, complete metabolic count, and troponin was drawn. The client has a history of lung cancer. The client takes acetylsalicylic acid, 81 milligrams by mouth once daily due to a history of a cerebrovascular accident. Client denies shortness of air or chest pain. Client will be going down to computed tomography shortly. Great job, friends. All right, now bonus question here for you. Which of the following vital signs of this client seems concerning to you? So which of the client's vital signs seems concerning? So is it the blood pressure of 140/90, the heart rate of 110, pulse oximetry of 98%, and we know RA stands for room air, and respiratory rate of 16. All right. So the client's blood pressure and heart rate are definitely on the higher side of normal. We know a normal blood pressure is 120/80 millimeters of mercury, and our normal heart rate is between 60 to 100. Now, bonus question, what does that acronym BPM stand for? This is beats per minute. Now, when labeling respirations, it is breaths per minute. We also like to see our oxygenation saturation to be around 95 to 100% on room air and a respiratory rate of 12 to 20 breaths per minute. We know that the client is in pain, and as they stated, out of 5 out of 10, so the vital sign is a great indicator of that as well. Also remember that pain is our 6th vital sign. When a client is experiencing pain, we can expect their heart rate and their blood pressure to go up. We may even see the client's respiratory elevated as well. Now let's walk through what tests were completed on this client. Which test was completed to assess for an infection? Was it 1, a CBC, 2, a CMP, 3, an ECG, or 4, a troponin? And if you guessed a CBC, that is correct. Now, what does CBC stand for? It is a complete blood count. With this lab, we are specifically looking at those WBCs, which stands for white blood cell count. In a client with an infection, we would expect to see an elevated white blood cell, as the body is fighting off the bacteria, virus, or other foreign substance. Now, what is a CMP? This is a complete metabolic panel. This is looking at our liver and kidney function, as well as electrolytes, but not infection. What is an ECG? An electrocardiogram. As we mentioned, reviewing our nurse's note, this can be used for a cardiac assessment. Now, the note states that the client had a history of CVA, which is cerebral vascular accident or a stroke. So we definitely want to rule out anything cardiac related as well as part of this client's workup. Women may present with abdominal pain while having an MI. Do you remember what an MI is? A myocardial infarction. And last, what is troponin? This is a specific marker that looks at cardiac damage and is a typical lab drawn when working up a client who may be having a potential myocardial infarction. Now let's see what happens after the client gets back from CT. So the client presented back to CT with what showed appendicitis. The client's provider sent in some new orders, so let's take a look. Place client on NPO diet, morphine IVP 0.1 mg per kg Q4H PRN for moderate to severe pain. Monitor vitals and obtain updated WT prior to SX. Now let's walk through these provider notes together. Again, feel free to pause the slide and take a minute to think of what these abbreviations may stand for. All right, now let's see how you did. Place this client on nothing by mouth diet. Morphine intravenous push 0.1 milligrams per kilogram every 4 hours as needed for moderate to severe pain. Monitor vitals and then obtain updated weight prior to surgery. Awesome job, friends! Now, acronyms do not have to be scary, but it's important that you're familiar with them as they can show up in a variety of different settings and orders. You all did a great job today. Remember to subscribe to our YouTube page to stay up to date with the latest Sarah Michelle NCLEX review videos. We'll see you next time.